we've got the perfect opportunity today because we've got everybody in the room that we actually need in terms of the groups of people that they represent. We've got the employers, we've got the local authority, we've got public health, we've got businesses, and there's a whole range of businesses here from small to medium and some of the larger businesses in the county. And I think together we can actually create a really good outcome from this conference. And one of the things I want to do is work with the small to large I suppose it's small to large businesses who are the majority of businesses in Suffolk, because I feel they hold a key. They've often got these issues in their workplace, but they're very small numbers of employees. And I was talking to a businessman the other day who's based in Thetford in Norfolk, and he was saying it's a very awkward conversation to have with the 62-year-old about when does he plan to retire. He can't actually have that conversation, but he knows this 62-year-old, is finding the pressure of the manufacturing business that he's in quite a struggle. So I feel if now we can start getting in earlier with the earlier age group and helping the businesses to really think about their employment and their employees and what space they can create for physical activity, I think this is it's really giving the employee far more than just the number of years they've got left in their employment. It's giving them their life. And I think what we hear from these inspirational people who are even over 100 is actually remembering to live, remembering to enjoy work, remember to sort of enjoy life is the key to success and happiness. And that's what we'll be coming out of today.
I think that we're in a situation now that we've never really been in before in public health, and we're facing this kind of perfect storm where we've done so much work on kind of keeping people healthy and making sure that they're not dying of infectious diseases over the last 100 years, that now we've got a population that's actually living well into old age. But we also have this cohort of older people my kind of age, mid-40s and up, who are leading pretty unhealthy lifestyles. Lots of people who are overweight, generally people who are pretty inactive. And we're going to go into old age not able to really do all the things that we want to do. And coupled with that, we're also facing diminishing resources, not just all the austerity measures that are around at the moment, but really that there just won't be that many younger people around to be paying the taxes that we would need to support the services for us in older age. So we're facing this perfect storm of increasing demand, increasing need, and decreasing resources. And that's why we really need to change people's lifestyles now so that we can keep people healthy and so that when I'm old, I can do all the things I want to do.
I think the ageing population presents us with both a challenge and an opportunity. A challenge in as much as we know that sometimes it's not easy for people to make that move to get into an active lifestyle, and we know people want support and help and opportunity. So that's the challenge. The opportunity is that, on the other hand, we know there's lots of older people that actually do want to try. So in this sense, we're pushing an open door that in their new life, whether it's retirement, later age, people want to have a go at something, and perhaps the new generations are not prepared to sit around like perhaps previous generations have. And that's a challenge also to the providers, so that if we're seeing new populations of 70, 80 and 90, what can we do to meaningfully engage those people? Because previously we've only thought of being old as around 50 and 60, and that's really young now. So big challenges with the older population. I think one of the most important things about encouraging people to be active aging is who are their role models? Who do they look to for inspiration or motivation? And do you know what? It's not always Olympic athletes. Sometimes it's the man or the lady next door. So there's a lot of good work using peer role models as agents of change. Volunteers will take the time out to motivate someone, to buddy them on their first visit on a walk, because we know we are actually influenced by someone like me. So if I've got dodgy knees and I'm reticent about wanting to get involved in activity, I'm much more likely to be convinced by somebody else who's got dodgy knees, because they've made the change, they've accepted the challenge that I'm now looking forward to. I think we've seen lots of examples of peer mentoring, buddying type programs that really are effective, not just for the participant, but also for the volunteer themselves. Their health improves as well.
Well, in my case, I thought that I have to do something very active in my retirement. I decided I always play sports. I would never stop playing sport. I started playing sport at the age of really competitive sport at the age of 14. I started bodybuilding of all things, and I realized how important it is. In fact, one example of sports is that a friend of mine, when we started, if you take his shirt off, you could count all his ribs. He was so thin, and he was bow-legged. And by doing bodybuilding, in 4 years' time, he won Mr. Guyana. And then it really showed me how important training is and exercise is, and I've done that for many years, all through my Air Force career. And another thing, when I was working in Holland, I was a flight simulator specialist. And I went to Holland on a contract to do work on the 747's flight simulator. And in those days, working on those sort of equipment, you concentrate so much that I was getting terrible headaches. And I thought, I need to do something about this. So I decided to stop at a hockey club in Holland and inquire if I can play hockey. And I started playing hockey, and for medical reasons, the headaches just disappeared because I was active. And things like that. So this is why I pay very much importance of playing sport, and I wouldn't stop until every joint seized up.
Well, we're an ageing population. Today there are 67,000 of us aged over 75. By 2030 there will be 127,000 of us. So that's a 90% increase. So it's incredibly important that we have programs in place to help people age actively, so that they're fitter, they're healthier, they have better social lives, so they're connected. And these are the things that will help them live longer and actually in good health as they approach their older age, rather than in poor health. And I think by working on all these things together, we can all improve our health. It's not just for older people, it's for younger people as well, as we've seen here at the conference today. And it's about working through all those different stages of life so we can all have a better life.